any questions, but also you can add these questions in the chat as we go along. For those of you who don't know me, my name is Billy Jo Caulfield. I'm a Primary Care Support Officer for the Clinical Effectiveness Group. I also have my colleague Ranjan and Charlotte here, who will both be monitoring the chat for any questions. So we're going to move on to the presentation now. So the aims and objectives of this webinar is how do smart templates work? So I'll do a live demo for you and the importance of using templates. Before I go into the LTC template, practices will have different systems and templates available to them. So for example, we have EMIS with Resource Publisher. So you currently have the LTC template active for your practices. And then you have EMIS with Template Manager. So this will still require the practices to import the individual templates sent by us. And then we have System 1, which you currently have all the individual templates, but the LTC template will be available by the end of January for you. So we know it's confusing which template should I use. So for long-term conditions such as CVD, diabetes and local incentive schemes, including asthma, COPD, cancer care reviews and all the QOF domains, if you're on Resource Publisher, please use our LTC and LIS BHR CEG version 3 template. If you're not on Resource Publisher, then you will have the individual templates that have been sent by us. We also will be publishing some other smart templates shortly, which we have had available in our other localities for quite some time, but due to practices not being on Resource Publisher, we haven't been able to offer these. So we will be offering our women's health template, which will cater for antenatal checks, postnatal checks, cervical screening and contraception. Our child health template, which will cover child IMS, safeguarding, 6 weeks baby checks, FGM and asthma, and a lot more areas. We will inform you via our e-bulletin once these are available. Here is a list of the EMIS templates that are currently available to you at the moment. I'm not going to go through these. These are just screenshots for you to have when we send the presentation. We also have a list of the System 1 templates which are available to you at the moment. So how do smart templates work? So they customize to each individual patient's needs using visibility rules. So what I mean by visibility rules is that, for example, if a patient is on an asthma QOF register, we build concepts within the template to allow only these pages to show for the patient. Also, another example is if a patient was on asthma, diabetes and heart failure register, then only these relevant pages would show. This is an example of the areas the LTC template covers without any visibility rules. So you can see it covers all your LIS information. So you've got your AF, your diabetes, palliative care, mental health. You've also got some QOF pages for the CKD, depression, epilepsy, and then obviously some relevant pages for all patients that will show, and that's your adult immunisations, PHQ-9 and GAD-7, lifestyle intervention and ethnicity pages. So I'm now going to do a live demo for you to show what it will look like within a patient's record with visibility rules. So I'm just going to change over to my screen. So as you can see here, this is our LTC template. So you can see across the top that it will tell you about the 1 star, which will identify the cough indicators, and the 2 stars, which identify your LIS payment indicators. You'll see here there are some rows that are showing for this patient. So for this example, this patient's on the asthma, diabetes and a heart failure register. And then you can see on the left-hand side that these relevant pages are showing. So you've got your asthma and COPD, your diabetes, insulin and GLP-1 will show for diabetic patients. And then you've got your cough CVD page, which is where you can find your heart failure register, hypertension, PAD, stroke, TIA and CKD. So these will all be within this cough CVD area. But for this relevant patient, only the heart failure register will show. So I'm just going to go into your LIS information. So this will give you all the detailed information from your specs for each individual LIS that is currently available and running. But it will show for everybody the same. So there is no visibility rules on this page. So you've got your AF, asthma, COPD, diabetes, which I'll go into as you've all been running this one for quite some time now. So for example, your diabetes, you've got your 8 care processes which need to be done. And then you've got your 3 treatment targets, which needs to be done for payment. It does cover all your other areas as well, which I'll show you just briefly. Injectable therapies, learning disabilities, and mental health. You also, on the left-hand side, have your lab results page, which will show you any last entries that have been done for any of the blood tests. So as you can see here, for example, the serum LDL cholesterol, the last entry for this was 16th of January 2018 and the value was 3. If there wasn't any previous entry, then obviously it will show no previous entry for this blood test. So I'm just going to pick one of these pages just to go into a bit more detail with you. So I'm going to select the asthma. So as you can see here at the top, you've got your cough information. And then as I previously mentioned, you will have your stars. So you've got your double stars on the asthma high risk review, which if the patient's on the asthma high risk review search, then you'd need to tick this box. You've also got your asthma annual review done. We have added in some diary entries, so some follow-ups, so you can tick that box, and if you want to see them in 3, 6 months, whenever it is that you want to see them, you can just go along and add that in. You've also got your 1 star for your number of exacerbations in the past year, which is a cough requirement. Please do add 0 if there hasn't been any. And then you've got your asthma management plan, which is also a LIS requirement, so you can just select agreed. It does also cover other sections, so you've got your asthma examination section, your asthma control test. So this, we do provide a hyperlink within the ACT section, and if you click this section, it will take you to the relevant web page where you can click to do the ACT score. You'll also have a section for a spirometry, adherence, inhaler technique, which again you've got your 1 star, and management, so any number of asthma A&E attendances in the last year, occupational asthma, depression screening, smoking status and vaccination status. You also see at the bottom you have quite a lot of pages which will show for each patient. So you've got your carers details, You've got your adult immunisations. You've got your cervical smear, which obviously will only show for female patients. You've got your PHQ 9 and GAD 7 page, lifestyle intervention page, and your ethnicity page, which is a national requirement for all patients to have their ethnicity recorded in their records. So please do add any ethnicity recording if the patient hasn't had it previously. You also have your admin and PCA page. So this is your personalised care adjustment, which is what replaced the previous QOF exception reporting. You have your treatment and exceptions. So this will include, for example, the anticoagulation, contraindicated, not tolerated. You can select one of the codes. And also your version controls. So we'll now put version controls on our templates. So then it will let you know what changes were made when we've updated any of our templates. So I'm going to go back to the presentation now. So I'm going to stop sharing my screen and we're going to go over the importance of using templates. So the importance of using templates is consistency in data entry. So you can see here for this example, if you type in diet advice into your consultation screen, you're going to get this big list of codes that you can pick from. So it is then hard to know which is the right national code that's being used for QOF or for your local enhanced services. It saves time, so rather than typing in the consultation screen, you can tick the boxes. The boxes will have the national codes behind them, so you'll know that you're using the correct codes for any payments. This will be one click rather than typing the whole word and reduces the chance of possibly picking up an incorrect SNOMED code for payment. The template allows you to see the previous entries, as I mentioned before. So as you can see here on this example, you've got your smoking status, which was the 8th of June 2020. But this is also a very good function for blood tests, especially for diabetic patients and their HbA1c. You can then identify if this patient's had their HbA1c carried out in the relevant time frame. No missing out on payment. So as I mentioned previously, you have your 1 star for your QOF indicators and your 2 stars for your LIS indicators. The template will guide you through a clinical pathway, and all that is required clinically will be in the template in line with the CEG, NICE and government guidelines. The layout of the template is designed to go with the flow of the consultation. So you'll have your height, weight, and then BMI. And the template will provide you with detailed information on your QOF indicators and any LIS indicators. So I've put a list here of all our CEG contacts and the hyperlink for our CEG website. We will put in the chat a feedback form. If you could complete this, we would much appreciate it, and we will send it out with all our slides for this presentation as well.